I'm Paige Messeri. I'm a licensed clinical social worker and EMDR therapist in the state of North Carolina. I am so glad you're here watching. I want to have a real conversation with you about what EMDR is, how it works, and most importantly, how it can help you find relief from trauma, anxiety, and stress. By the end of this presentation, you should have a way better idea of what to expect if you decide to pursue EMDR therapy and what that journey can look like. Have you ever felt like the past just will not let go? Like certain memories keep pulling you back? Well, you're not alone if that's the case. EMDR therapy has helped so many people get through and process those difficult experiences and finally feel a sense of freedom again. If you're in North Carolina, I offer virtual EMDR intensives that you can actually get support from the comfort of your own home. So I'm going to walk you through the process of what to expect with EMDR. I'm going to share some client insights and explain why EMDR intensives are so powerful in healing. And by the end, you'll have a clear understanding and hopefully feel confident about taking that next step toward healing. So let's get started. EMDR stands for eye movement desensitization and reprocessing. Essentially, it helps to process through past traumatic events or distressing experiences so that they don't hold this intense emotional charge anymore. So if you can, as a metaphor, I want you to imagine carrying a heavy backpack full of all of these past moments in your life that made you feel like I'm not good enough, or I have to be perfect, or I'm not safe. And as we do the EMDR work, we just unpack that weight one memory at a time using eye movements, bilateral tapping, or bilateral stimulation that's auditory. And a lot of clients are like, is this voodoo? Is this magic? But it really is evidence-based, and it's been proven to even heal folks from PTSD. So what happens when we're impacted by trauma is we go through something so upsetting or so overwhelming that our brain and our body, it just can't quite tolerate it. It's too much too soon or not enough, and it gets stuck in our system. And the cool thing about EMDR is that it works with your brain's natural healing abilities. We use the bilateral stimulation to file away those old memories or old narratives in a more adaptive way so that they're just not weighing you down as they have previously. By now, you know that EMDR is an effective way to process your trauma and distressing experiences, but how does it actually work? Well, EMDR follows an 8-phase structured approach that's designed to help you feel safe and supported and in control every step of the way. So each phase serves its purpose to gently guide your brain to process through painful memories that can finally bring you a sense of relief. And instead of walking through each phase step by step, let's just talk about what this actually means for you. You don't have to keep reliving your trauma time and time again in the present moment. EMDR helps your brain naturally reprocess and store those difficult memories in a more adaptive way so that it loses some of its emotional charge. So instead of feeling stuck in the past, you can finally move forward. It also means that you get to stay in control. So every session is designed safe and structured, moving at a pace that feels right for you as an individual. So you're never going to be forced to go somewhere emotionally before you're ready. And lastly, what I personally love about EMDR is that it's about lasting change. So with the process, we can actually get to the root of what is causing you distress rather than just managing your symptoms like typical talk therapy can focus on. Essentially, this means that triggers lose their power over time. And this is what makes EMDR so powerful. It's not just about understanding your past, but it's about actually breaking free from it so that you can feel lighter, more at peace, and fully present in your life. So a big question that I get is who can benefit from EMDR? I work with a lot of folks with anxiety, who struggle with people pleasing, people who have had recent traumatic events or a major loss or a major life change, breakups, divorce, anything that is feeling difficult to move move past, or it can just be a series of smaller events that are holding somebody back. So it can be work-related trauma or harassment or medical trauma. There are so many things that EMDR can work for. You don't have to have gone through something big to benefit from it. So I say that so that people reach out for help and pursue EMDR if it's something that sounds interesting to them. Okay, what to expect in an EMDR session? I know for some people it can feel intimidating, it can feel scary, and so I like to send over a lot of research and articles and videos for people to really understand what EMDR is on all of these different levels. And on a certain level, it's hard to really understand it until you're experiencing it. But sessions can be 50 minutes to 4 hours for myself. I know some therapists will do longer intensive sessions than that. But I like to work with my client's nervous system to make sure that they feel safe and supported, and we go at a pace that is right for you. It's something that feels safe enough, because if we overdo it, if we push too far, then that's not going to be effective. So I am here to support you through the process, and there's so many different ways to do EMDR. So it is a very collaborative, personalized type of treatment. And just to give you an idea, if you do 50 or 55-minute sessions, typically the amount of reprocessing time that we will get in those sessions is maybe 20 or 25 minutes, because we will have kind of the check-in at the beginning of the session to see what's gone on over the past week. And sometimes there's a different crisis of the week that comes up that we might have to focus in on. And what can be nice in those extended EMDR sessions is that we can really build the momentum and stay in it and essentially do more of the heavy lifting in that one sitting, rather than opening it up, closing it up nicely, and coming right back to it the next week. And then I just wanted to share some client insights, and these are paraphrased, but one client said, "I've always known intellectually that I'm enough, but EMDR genuinely helped me believe that on a deeper level in varying circumstances." Another client said something along the lines of like, "This is like physical therapy, but for my mind." Another client said, "I'm feeling more relief from past ways of thinking than I ever would have anticipated." So I get this a lot. People try not to have super high expectations, because this is a new type of therapy for them. They don't know what to expect. They're trying not to get their hopes up. Maybe they've done years of talk therapy in the past, and it's just not quite moving the needle. And so oftentimes people are really pleasantly surprised and grateful for what EMDR can allow them to do. A lot of clients have said, "Is this voodoo? Is this witchcraft?" It just feels so impactful that it can be hard to believe. And it can be hard to believe that this will be sustainable. But whatever we work through, whatever we desensitize and neutralize in your system, typically stays that way. And truly, it is hard to believe until you go through it, but it does feel magical at times. Okay, so why choose an EMDR intensive? I know I've touched on intensives and how they can compare to regular sessions, but essentially this can allow for quicker results in less time. You can actually save money by working intensively compared to the weekly therapy model. This can be wonderful if you just have a busy life, or if you want to make progress faster. I have a lot of clients who have their regular therapist for talk therapy, and then they will come see me maybe once or a few times for adjunctive EMDR intensives. And I can also collaborate with their therapist to make sure we're covering what is going to be most helpful for them and what kind of sticking points they're having in current therapy. And this can feel kind of new or different for many, because we just get used to the model that has been instilled with insurance companies of like, okay, you can only meet for this amount of time and that's what's going to be covered. But with longer sessions, we can really do so much more, and it is actually so much more gentle on your system to not have to rush in that hour session. So with those long 3 or 4 hour intensive sessions, it gives us time to do grounding work, to do meditations as needed, to kind of dip in and out of the past distressing experiences. And I like to use internal family systems. I like to use somatic work with that, or creative expression. So it just really allows for some pretty cool things to integrate that deep trauma work. So if this is sounding interesting to you, I want you to know that you're not alone in this journey. Taking the first step can often feel overwhelming and scary, and that is why I offer a free 15-minute consultation. So this isn't a commitment, it's just a chance for us to chat and see if I'm the right fit for you, if EMDR is a good fit for your needs and what you're hoping to work through. So if you are in North Carolina, please feel free to check out my website. It is therapywithpaige.com to schedule your free 15-minute virtual consultation. And if you decide to move forward, I offer virtual EMDR intensives, and that can support you from wherever you are in North Carolina. Thank you for watching, and take good care.